I'm Dr. Chintan Doshi, a pediatric orthopedic surgeon from Mumbai. I've done my specialization in pediatric orthopedics from Mumbai. I've done my super specialization from Singapore and US. And we are here today to talk on different conditions of pediatric orthopedics which we face in daily life. Sports injury, the word itself says any injury which is caused due to sports. It may or may not happen while playing a particular sport. It can be even, having an injury while riding a bike or a motorcycle or something. But these sports injuries are very particular. They can be fractures of the bones, which are particularly seen in some sports, like football will have some kind of fibular fracture at some point in time. When the child falls on outstretched hand, there is a wrist fracture. These are bony fractures. This may or may not occur because of sports. The specific term for sports injury is usually the injuries which are ligamentous. So ankle twisting is very common in football, and even in cricket, when you're running around to catch a ball, you can twist your ankle. This will cause some ligament injury in the foot. This is a sport injury of the ankle. Similarly, there is sports injury of the knee, which is ACL. Most of our cricketers, when you see having a knee injury, who have gone through a period of 2 to 3 months of rest out of the team, they usually have meniscal or a ACL tear or some kind of ligamentous injury which has occurred while playing sports. There can be shoulder injuries, which are also sports injuries. So, rotator cuff tears. Uh, in fact, our Olympic medalist has also gone through a sports injury and then won a gold medal for us. He has been operated for that and he has won a gold medal for us. So, sports injuries are part and parcel of life. They can happen to anyone at any point in time, and they can happen at any joint. It is not that only knee injuries are sport injuries. Sports injuries can happen in ankle, knee, hip, shoulder, back, any muscle of the body like hamstrings pull or catch in the back while playing sports. So all of these injuries which happen due to particular activity are termed as sports injuries. Most of the teams, most of the players have their own physio, they have their own coaches, they have their own medical team. So initially, when a patient, when a player is suffering a sports injury on the field, first point of contact is their medical team, their physio, who looks into it. So they are the ones who know or who judge how severe is the injury. If it is, now this is for a professional team. Now let's consider a child playing for an annual day in their school. Now they don't have a professional help, but what we look into, that they have to approach a doctor. One, if the injury is causing a pain where a child is limping or where an adult is limping and are unable to walk normally, unable to do their normal daily activities, like if before he was throwing a ball and now he just suddenly cannot throw a ball. Before he could run, now he even cannot walk properly and is limping. That is the time to consult, because we don't want to neglect any injury and cause the injury to increase in its severity. If after the injury, after a period of rest, maybe 10 minutes, maybe 20 minutes, maybe half an hour, the player or the person who has got injured is doing all the activities normally, they can refrain from showing a doctor on an immediate basis and may consult a doctor if the problem persists. A lot of sports injury involve injury around the joints. I already told that they can be at the ankle, at the knee, at the shoulder, at the back, at the hip. The commonest symptom is the pain and the limp. They cannot walk normally, they cannot do their normal activities. So one is pain and limp. Second, the area which is injured will show some kind of swelling. There will be, because of the injury, there will be edema, there will be swelling. That is the second most symptoms. Then other symptoms are related to the activity. So if a player was playing football and got a knee injury, the further symptoms would include that initially there was pain and swelling, but in last 2 weeks, the player started experiencing give way, or sensation of falling down even while sprinting or turning around. So this is for knee joint. Likewise, for ankle joint, it will be repeated twisting of ankle even while doing normal activities like climbing stairs or coming down from stairs. They'll be repeated. Like it happened 2 times in this week. In the next week, it will happen 3 times. So repeated twisting of the ankle joint. In shoulder, it would be pain while lifting the hand above the head, pain while doing some activities of grabbing something or holding a weight. So all joints will have different kind of symptoms, but yes, if the symptoms are troublesome, consult a doctor. The most common way is by clinical examination. So where is the problem? Ankle, knee, shoulder. So depending on that, we do special tests and we identify what ligament could have injured or if there is a fracture or not. So this will help in diagnosing where the problem is, how severe the problem is. We do x-rays for bone fractures and ligament injuries as well. And following this, the most important thing in sports injury, because it is involving the soft tissues around the joints and bones, we do MRI to confirm the diagnosis that yes, this ligament is torn, and it will also give you a exact location of where the ligament is. It torn closer to the bone or in the mid substance? How severe it is torn? Is it torn completely, partially? So all this will be seen on an MRI. First diagnosis is by clinical examination to confirm and to know the severity. It is what MRI is what has been done. Treatment of sports injury, again, depending on what sports injury patient has suffered. Uh, if it is mild injury which can recover with physio or exercises and cold fomentation, crepe bandage, application of plaster, then we usually don't suggest surgery to the patient and we give this kind of conservative management. Uh, First thing, when the child child or the adult who's playing sport is getting an injury, what we follow is a rule of price, PRISCE. So P is painkiller, give painkiller so as to alleviate the problem of pain from the player. R is rest. The area which is injured, the shoulder or the knee, give it rest. Don't try to mobilize it quickly because it will cause more pain and more trouble to the player. I is ice fomentation. So we do icing, which will reduce the swelling and reduce the pain as well. And then compressions. We do compressions again for swelling. So crepe bandage application or a brace application will reduce the swelling. And elevation. So elevation, what will it do? It will one ensure rest, because once the limb is elevated, the child is or the player is not walking. So it will ensure rest. Again, elevation will reduce the swelling because it will allow the fluid to flow towards the heart and it will not allow the swelling to increase in size. So this is the first golden treatment in sports injury. So that is price. And then individual ligaments and individual, depending on the severity of injury, there can be surgery, there can be rehabilitation, there can be physio. Depending on how severe is the injury, we suggest accordingly. Any injury, there is obviously a recovery phase. If there is a fracture, the recovery would be somewhere around 1 to 1.5 months. Maybe a little more if the fracture is completely displaced, would require surgical procedure. In ligamentous injury, which are very mild, the recovery is as early as 2 to 3 weeks. Most of the ligament injuries which are severe and which would require surgery, like a ACL tear, a complete tear, a player who has undergone a surgery after 1 month of injury, usually we don't allow for the first 3 months to go back to sports. But that doesn't mean that the player is not doing anything. Player is rehabilitating. So we give them exercises, physio to strengthen their muscles. So as soon as that period of rehabilitation is over, the player is ready to go and play professionally. So the rehabilitation goes on, actually should start from the first day itself, depending on how severe the injury is. But then eventually that is the amount of period of time is required for complete rehabilitation and recovery in individual cases. basically we have to condition our muscles and joints and bones. So basically, if a person who is not trained for a particular sport goes and plays the professional game, or for the first time, there are more chances that he will have some kind of injury. I'm not saying all of them will have, but the chances increase. A person who's trained, who's coached, and who is doing this activity often, who's been doing warm ups, stretching, doing exercises before and after the activity of sports, is less likely to injure in a bad way. So, prevention is training, one, conditioning of bones and muscles, doing warm up exercises, doing stretching, and doing warm ups before a game or before going for a tournament. So this will prevent a bigger injury. Still, if there is no guarantee that I've done everything, I still got injured. That is the problem with sports injury. You take all the care, you still can get severely injured, provided what you're doing in that time of sport. You know, you're about to catch and you don't want to miss a catch, but you slip and you can get injured, even though you have done all the you have taken all the precautions. But if you're not doing warm up, stretching, training, and everything, your muscles are not trained, and chances of getting an injury increases.